Hello, it is me, Dr. Catherine Toomer, here for my Dr. Toomer Talks on Tuesday. And I want to apologize. I'm not sure what happened. I was supposed to have a guest today, uh, Dr. Reid-Thornton, and we'll figure it out. But anyway, I'll have her on another time. She was going to talk about chronic pain and how to help people become painless using a holistic and integrative method. So she's still linked in the by information. Oh, wait, here she is. Here she is. Here she is.
I'm so sorry.
No, no, no. I'm so excited. I was just going to say, oh, no. It is okay. So, well, welcome,
Thank
Dr.
you.
Ruth, the
Thank
new
you.
Dr. Ruth, not the old one.
Yeah, not the old one. And I don't have her accent. So,
Young folks don't know what we're talking about, but that's okay. Well, I'm just going to introduce myself and then I'll let you introduce yourself. Of course, I'm Dr. Catherine Toomer, family medicine and community health physician, and founder of Health, Wellness, and Weight Loss Centers and creator of Total Wellness and Weight Health programs. And today, a little different than what I've done in the past where I just did the lives alone. I've started bringing in some experts about things that I don't know a whole lot about and want to learn about, and hopefully you guys will learn as well. And so I've invited Dr. Ruth Reid-Thornton, and I'm going to let her introduce herself because what she does is really, really interesting. And any of you who have chronic pain and want to know how to be pain-free, painless, and live your best life, please listen because she's here to help you. So why don't you introduce yourself and tell us a little bit about what you do and who you are?
sure, sure. And again, thank you so much for having me. It's an honor. I heard about you long before we had an opportunity to meet. You didn't know about me, but I knew about you. So this is awesome. This is awesome. So yes, I'm Dr. Ruth Reid-Thornton. I am a physiatrist, that is a physical medicine and rehab specialist. Been doing that for more than 20 years. I also in addition to be board certified in that, I'm board certified in holistic and integrative medicine, because I have found people with chronic pain, many times it's not one thing will help everybody. And just my passion and my curiosity to say what else is out there, what can help them. And so this is actually a new venture for me, even though I've been practicing medicine for many years. But I do feel that there's a space that can be filled to help, specifically help people, whatever the reason for their chronic pain, to work alongside with them in managing it, getting it under control, so that the pain's not controlling them, but they're in control of their lives.
Okay. Well, thank you. And as you know, I do a lot of wellness. And so I talk a lot about people feeling it's not just about losing weight in pounds, but the weight in whatever's weighing someone down. And so
Mhm.
chronic pain is definitely one of those things, and it causes a lot of stress for a lot of people. And as you can imagine, for those of us who've ever been obese, know the lower extremity really suffers.
Absolutely.
Our weight bearing joints, our knees, our ankles, our hips, our lower back.
Mhm.
So, and what would you recommend for someone who is right now having a difficult time saying, I want to lose weight, I can't really exercise, or can they? And what should they do to kind of start them on their journey?
Yes, a great question. Well, yes, if you feel like you can't move, exercise cause. But the thing is, exercise is medicine. Two things to me are pillars: food is medicine, exercise is medicine. And they should probably, before we start about the exercise, evaluate what they're eating, because if you're eating a lot of things with sugar, sugar we know is inflammatory, and you want to make your internal environment as anti-inflammatory as possible. So eating fruits and vegetables, drinking lots of water, maybe even lemon water, things that are going to help kind of clear out your system, get rid of the inflammation. That really can help when you're consistent about that. Getting rid of a lot of processed foods. A lot of the foods, a lot of the additives they feel are affecting our bodies. They're not normal nutrients. So trying to just alter that, not necessarily you deal with obesity. I that's just a side. I think if you eat healthy, the weight's going to come off as a natural part of and you'll feel better. As far as movement, I was just interviewing a yoga specialist, and she pointed out the fact that even just breathing, starting with breath, is movement. It is movement. Many times people in pain, people stressed out, they're not breathing well. They're very, very shallow breaths, maybe sometimes rapid breaths. So just take the time to breathe in deeply, in and out deeply. One of the things that's going to do is bring more oxygen into your brain, and you have more oxygen in your brain. It stimulates the production of your natural opioids that your brain makes, and so you have natural painkillers with that. It's going to help to lessen your stress, and stress is very significant in chronic pain. What's happened with chronic pain is their system was trying to heal. Like if you think about an acute injury, there's an inflammatory response, there's an immune response, and all of that is supposed to come to an end and conclude to the other side of being healed. But when people get stuck in chronic pain, it's like the whole system really gets out of whack. The body's still trying to help you, to be honest, but there's so many different factors that's creating this environment that continues to keep you in a state of pain and stress. Your sympathetic system, the fight or flight response is activated when that's not our normal state. Obviously our normal state is to be at peace and parasympathetic in control. So my thing is really trying to help get people back into that state. And even just 5 minutes of walking in your house, if you can just do 5 minutes of walking every day, you'll see over time that that's going to get easier. And then you can bring it up to 10 minutes, So that's, I guess, what I would want to say about that.
Okay. So you heard it here, breathing as a form of pain relief. And it's not just any breathing. There's a certain type of breathing, and it is a certain type of deep breathing. I don't know if you're familiar, but Dr. Tiger did a workshop for my program. And in that, she actually gave that breathing exercise.
Oh,
And
great.
how we can breathe and kind of increase our parasympathetic response.
Mm-hmm.
So what should someone do if they have pain and they don't know why they're having pain?
Yes. Yeah.
Does it matter what kind of pain it is, or is there some place they can go just right from the beginning, just to find out where to start?
That's a very good question. If people are having pain couple of weeks and it hasn't gone away, they really should see their primary care doctor. That's really where to start. My practice is a telehealth medicine practice, so I'm restricted. I can't examine them, so they really do need someone to examine them, and maybe there's some tests that need to be done. But unfortunately, a lot of times people have this pain and they just keep going and going and going. Why? That doesn't make sense to me, really, but I know we're like that, right? We just think it's going to go away, and we don't really do anything about it. And it could be something mild, it could be something serious, it could be osteoarthritis, it could be something else. It's important. If the pain's not going away, you really need to find out what's going on with you.
Okay. Well, before we continue, I just want to say very quickly, hello, Dr. Celine Lee, and hello, Dr. Christina Dewey. They're listening, and they said hello to us both.
Oh, great.
So, so I'd like to ask you this. So you mentioned that you do telehealth. So are you restricted to certain areas of the country? Can anybody come and get your services?
Yeah.
Do any type of coaching or anything else outside of just telehealth?
Right. At the moment, it's strictly telehealth. But I can see anybody wherever they are. It's for telehealth. Actually, for California residents, I can prescribe medications, perhaps, but I'm really not I shouldn't say interested. Interested is not a good word. this isn't for someone who wants to do their opioid maintenance. You know, some people do know that there are practices they should see for that. I'm not going to be equipped to do that per se. But yeah, anyone could see me. I also, you know, I can recommend supplements. You know, I do homeopathy medication as well, which is a whole different, it works so differently from ours. I think it's awesome. I like homeopathy a lot. Someone described it, and it's true. It's more of like an energy medicine, because what they do is they take a substance, homeo like pathy, you know, disease, like treats like. So they take something that causes the symptoms someone has, but they dilute it, and they dilute it, and they dilute it to where it's like the essence of the substance instead of the actual substance. And you think about that, that's potentiation, that's energy. So it works on a different level than, you know, the pharmaceutical medications that we use. And so it's actually working to help your body to respond, as opposed to doing it something to you. It's helping your body to have a response to combat the disease. You could think of it like a vaccine, but
I was going to ask.
Yeah. So yeah, I just think, I feel like it's time, you know, when you do certain things for so long, and you know that there's more that you could do to help people. You know, I'm kind of ready to do that. I should also just put out for anybody that's interested, I'm launching, my practice is launching next week on Saturday, February 25th, this coming Saturday, 10 a.m. Pacific Standard Time. I'm having a launch party from 10 to 11. We're doing a healing movement class. So yeah, if they go to, well,
so what would be, could they find more information? Do you have like a website or a landing page?
Yes, I have a website, www.chronicpainrescue.com. I have a Facebook page, Chronic Pain Rescue. And if you go to the Facebook page or YouTube page or Instagram, you'll be able to see those invitations to register for the class. I put a price on it, $15. Really only because I know how I am. If it's something I say I'm going to sign up for and it's free, and I'm just forget all about it. But I put a little money in it, I'm likely going to go, because I put some money down. So so that's sort of the impetus behind that. I hope a lot of people will partake of it, especially if you've never done it, like healing yoga. You know, it definitely, for people who are having trouble moving, stiffness, pain, tightness, muscle spasms, it will be a great thing for them to participate in.
Okay, so I put what you said on the bottom. I just want to make sure that's accurate. Chronic Pain Rescue.
Yes, that is accurate. That's absolutely it. Yes.
So I'll leave that there. So anyone listening, you can go to that website and get the information you need. One, to work with Dr. Ruth to find out more about what she does, but also to attend her event coming up this weekend, where you can actually learn practical measures to help with pain, for pain management. And that is, you know, anyone can tell you who's ever been in pain, the feeling you get when that pain goes away is really something. It's life-changing. And so I wanted to make sure that was there before we got close to the end. So what made you decide to go into this area of medicine?
Oh, okay. That's a good question. It was back in medical school. My mom's a pediatrician, by the way, but so I thought, you know, I helped her out as a teenager in summers, and I thought I was going to go into pediatrics. I got to medical school, and in the hospital, I found I did not like sick children, not because I don't like them, but I felt like I don't want to poke them. I don't want to draw blood from them. I don't want to do it. I was like, no, I just want to hold them. Why would I want to do that to them? So it wasn't for me. And I had to find another specialty. And I did an elective at the National Rehab Hospital in Washington, D.C. And just from day one, I really loved it. I love the fact that it's a team. team approach is a normal. Multidisciplinary approach is a normal part of our practice, because it takes the physical therapist, the occupational therapist, the social worker, the doctor. We all work together to help that person. And that's not just about a body part or an organ system. You know, you're concerned about the whole person and how they deal in their environment, how they you know, can function, you know, and so I really loved it. I really loved it. It was an easy decision once I found it. And, you know, it's different aspects of it that's interesting. I mean, when I got out, the first job I had after residency was a horrible place. I was like, oh my gosh, I never knew this side of medicine. It's very the seamy side of medicine that I had no idea existed. So that was an eye opener for 1 year. It's funny that the doctor they had before me told them he was dying of leukemia, and he got out of his contract, but I heard he was actually working somewhere else. So.
Oh no. That's horrible. God, I would not want to put that out into the universe. But well, before we continue, I just want to say hello to Heather, Tawana, Tanya, and Olufunke. Thank you for joining us. So and then I have a question. So if someone has seen their primary care doctor, they are told that they need some type of movement, they need some type of plan to become pain-free. And if they had or they know someone, what exactly what should they do to contact? Well, I mean, we know how to contact you, but when should they contact you? How can they get referred to you? Or is it necessary to be referred? Can they just come to you directly?
Oh, they definitely can come to me directly. I'm not taking insurances. It's a cash-based practice. You know, I know a lot of I've heard, I don't say a lot, but I've heard people complain about the healthcare system, that the doctors and the pharmaceutical companies and the insurance companies were all in cahoots. And I just really want to let people know, no, don't put the doctors in that in that box. You know, we are not looking to see people every 15 minutes like we're some kind of fast food store. That's not what we signed up for. So, you know, I wanted to be able to take the time to get to know a person, what their problems are, what their goals are, and how best to direct and guide them into getting that help. So at any part of their journey, if they're in physical therapy and they feel like it's helping, great, because I believe in physical therapy. But you know, if they've gone through physical therapy and they're not any better, or you know, this is long lasting, maybe physical therapy works for a minute, and then you know, when it's over, they go back to where they were. You know, that kind of thing. I feel like I can help. So, you know, they can see me at any point in the journey. It's better if we can keep them out of chronic pain. You know, it's much better if we can avoid it altogether. But if they've had pain 3 to 6 months, that's chronic pain. And certainly a lot of people are out there with much longer, years and years, and they can get better. They should have hope. They should have hope.
That's good to know. And so if someone were to contact you to work with you, what should they expect? What are the steps?
Okay, so right now I'm trying to, they can go to my website to set up the appointment, but things are still kind of in the works with that. But I would meet with them for about an hour, telehealth visit. With the evaluation, depending on where they are and what they're doing, I can give them some exercises to do. We can make some goal settings. How are we going to get there? If they're not on, you know, a particular healthy diet, to try to help direct that. We address sleep. You know, if they're not sleeping well, sleep is very important for your healing. That's the time when your body's recuperating, regenerating. And if you're not able to sleep, either because of your pain or because your mind is running and racing, you know, we want to address those things. And getting their lives back in terms of society. A lot of times their family doesn't understand, their friends have kind of moved on because they can never do the things that, their friends do. So, what steps can we do to get their lives back in alignment with what they want, to be able to participate and be a part of everything.
All right. Well, just for those of you who do work with me, just know I will have her information listed as a resource so that, you can write down what you see here, but then also I'll make sure that you have access to her information. And I'll try to stay on top of what you're doing so we can keep adding to it. And so, and then also if anyone's worked with you hear a lot about the overlap. I talk a lot about, stress management through sleep and through drinking water. Of course, carbohydrates, including sugar, are an issue. And so what should someone actually eat? Now, we hear a lot about supplements? You mentioned that earlier, and about leafy green vegetables, which I kind of preach about a lot. If someone wanted to, now we also hear about costochondroitin and the other things are supposed to help with cartilage in our joints. What supplements are good? What supplements are really just people making a whole lot of money on other people's pain? So what should we look for when picking something? Should we even bother? What should we do as far as supplements are concerned?
That's a good idea. Good question. So some supplements that I do recommend, because they're anti-inflammatory, is fish oil capsules. They have the omega-3 fatty acids, which, you could also eat fish twice a week, but that's a good supplement to have. And it helps with the lubrication of your joints, as well as just providing you with things that are less inflammatory, going to fight the inflammation. I always had believed in glucosamine, and usually you find them in a combination of glucosamine chondroitin. Apparently, it's controversial. There's some studies that show it helps, some studies that the results weren't so great. But glucosamine and chondroitin are natural components of your cartilage. So you're basically just giving your body the building block to build up your cartilage. So it's not going to work overnight. It's not going to, you might have to take it a couple of months and see how your joints feel. If it's after a couple of months and you can feel a difference, then it's working. Then, but it's controversial. So I believe in it, but I know that
well, a lot of people who say that it's not something, usually they're not the ones who have the expertise in it. So if you, I would rather listen to you. So I do have another question for you. What about turmeric?
Turmeric, that was the next thing out of my mouth. So you read my mind. Turmeric has lots of evidence, of evidence-based literature. It works. It does help people. To be honest, I like to make a tea with it. A little apple cider vinegar, turmeric, and ginger, with some honey, of course, to sweeten it, because I know that turmeric is a great anti-inflammatory.
Okay. And I've also heard that adding pepper might activate it more. I'm not sure if that's true, if it's just, you hear all these things and you don't know how much of it's internet and how much of it's real.
Oh, right. I haven't heard of combining it with pepper, but cayenne pepper is what is in capsaicin, which is a topical. So yeah, cayenne pepper helps.
Oh, great. Well, this has been really informative. I appreciate you coming on so much. Is there anything else you'd just like to add, like just either, biggest misconceptions, or the one thing you wish people would do, or, just what we could do to make our lives easier? Anything that you'd want to leave us with?
Good question. One thing, I'm not sure about one thing. I just know that what's going on in your mind is just as important as what's going on in your body and your emotions. And I just would like people to recognize that to heal you wholly, you have to have a holistic approach. People want to just say, my only problem is I have this pain. You take care of this pain, I'll be fine. But they don't recognize that we are triune beings. We're made like our triune God. We are triune beings, and you have to address the other aspects of yourself to fully heal. And if you know that life is stressing you out, maybe you're unemployed, or maybe you're having domestic issues, those things have to be addressed. It's not just about your pain. Or maybe there's an injury, a trauma that happened in the past. And then you may not even be ready to manage that or handle that, but at least to be aware that that's part of you getting back to being well at some point, when you're able to look at that and deal with that. And there's other, interventions that I do, some psychologists do, EMDR or different things to help you to heal. Because usually the chronic pain is not, again, I believe in that multidisciplinary approach.
Yes.
And it's not one thing. It's like that awful beast in the room, and we got to just use every weapon we can to bring it down. So, yeah.
I think anyone who listens to me is probably sick of hearing me talk about the biopsychosocial approach.
Yes, that was a weird one with that. Yes.
Yes,
Okay.
yes. Well, thank you so much for joining me today. We've learned so much, and also I just want to say quickly, Sharita and Lorna, thank you for coming. I've already said the thank you to everyone else, and this has just been really helpful, and I hope you join me again so we can, if you ever have any programs, please let me know, because I will share them. Okay. Because this is really, really, really important. And I think that you brought up some really good points of things that we tend to overlook when trying to get healthy. And as you know, people tend to come to me for weight loss because they think that's the number one thing, but it's really everything.
Right.
So,
well, thank you so much for having me. I hope to be able to interview you as well. So
okay.
We'll have to work on that another time.
Yes. Well, thank you everyone for coming, and thank you for my Tuesday. My Dr. Toomer talks on Tuesdays. This is my first interview that I've done on it, and we're just good. We'll keep adding and doing different things. So have a good night, have a healthy night, and make sure you write down the website on the bottom so that you can follow up with Dr. Ruth and become pain-free.
Yes.
All right. Good night.